Wednesday marked the third and final day of the landmark Supreme Court hearing on the so-called Obamacare. Part of the Affordable Care Act calls for expanding Medicaid. That's because many people already using the low-income insurance program have trouble finding a doctor who will see them. Liam Martin has more.
Let me see.
Curtis Wilson has been waiting a year and a half to see a doctor about replacing his ostomy bags.
Between us, we spent 8 hours on the phone one day trying to find all these doctors, including the last one they gave me was a gynecologist, which I really don't need, obviously.
The father of two is on Medicaid and says only one doctor in Ingham County will accept new patients under his plan. That doctor has a full schedule, and in the meantime, Wilson is running low on bags.
I have a little bit of stockpile, but it's starting to get low where I haven't had doctors since September. I've added it up. Out of pocket, everything is about $235, $250 total a month if I buy just the bare minimum stuff they were giving me.
Wilson isn't alone. Medicaid patients across the country are struggling to find a doctor. The reason, many physicians say the reimbursement rates for Medicaid are simply too low.
When physicians are getting many dollars below what it costs them to provide a service, they will only do it for so long.
Jan Hudson with the Michigan Medical Care Advisory Council says Medicaid recipients have an especially tough time finding specialists and dentists, leading many to simply show up at the emergency room when push comes to shove. Under President Obama's plan, reimbursement rates would increase in order to attract more doctors into the system.
That is mandated for primary care services will bring the provider rates for primary care up to Medicare levels.
In Lansing, Liam Martin, Fox 47 News.
34 million Americans are currently uninsured, and about half would be covered under the Medicaid under the new law. In Michigan, that comes out to about 500,000 people. It would be paid for by the federal government and not by the states.